Well, now that South Africa is on the waiting list for the COVID-19 vaccine, second quarter of next year, the question is now, who's going to get the jab first when it eventually arrives? Research by the SA Medical Research Council has found the country is most vulnerable category is vastly different from the global norm. We're very special here in South Africa. The country has both a high poverty rate and a large number of people living with comorbidities. So how do these decisions get made? Let's get them discussed before we get there. Safura Abdool Karim from the SA Medical Research Council now joins me for more on her research and how she thinks we're going to be able to handle this. Safura, good morning to you. I cannot imagine trying to answer a conundrum of a question like who is going to get this vaccine when we do eventually get it, knowing we're probably only going to get 10% when it first is rolled out. Good morning. How do we decide to do this?
Good morning, and thank you for having me. I think the basic question is how should we be allocating and how are other people doing it, and then how can we adjust that to accommodate our population. So groups like the WHO have come up with allocation frameworks that can be used to prioritize vaccine access. And I think as a starting point, everybody agrees healthcare workers should receive the first jabs. But after that, it becomes more complicated because, yes, we should be vaccinating people who are vulnerable, and that includes people who are over the age of 65, but it also includes people who have comorbidities. And that's really where the trade-offs and the rationing needs to happen, because we have so many people who are HIV positive, they have TB, they have non-communicable diseases like diabetes or hypertension. Some of them have more than one condition. And then we've also got a large group of people who are over the age of 65. And so what needs to happen is government needs to decide how best we can allocate that 10% to ensure that we minimize infections and protect the most vulnerable people.
And this is where it's going to get very complicated, Safura, isn't it? If I'm taking a look at just part of what you've written two wonderful paragraphs I'd like to pick up on just briefly. Our Constitution requires that governments, I'm quoting here, takes action to protect citizens' rights to access to healthcare. Part 2 of this, human rights law requires equitable access to life-saving vaccines. But if we're only going to have 10% of COVAX for our population off the back of the problems you just highlighted, a lot more than 10% of our population are going to be considered critical for this vaccine. So who is going to have to make this call in the end, do you think?
So I think when you're looking at a human rights approach to vaccine allocation, and especially when you're using the word equity, it doesn't work to have, for example, people in the private sector disproportionately get access to a vaccine. It doesn't work if you say your vaccine access is determined by a price tag or how much money you have. So that's the first thing. And that's why I think using a government defined allocation framework is really, really important. It's not enough to say, okay, people in the private sector, you can access it at your convenience, and people in the public sector, you've got to wait in line. So I think that's the one thing that's really critical. The other is, when we're talking about preserving access to healthcare, I'm not just talking about people getting access to a vaccine. I'm also talking about the fact that we've got to reduce the burden on the healthcare system to make sure that hospitals are not overflowing. So that's the other component of vaccine access that's really important. It's not just about protecting the person who gets the vaccine, but it's about limiting the spread of the virus. And so that's why I think there is an argument to be made that particularly vulnerable, poorer groups who can't, for example, adopt measures like sanitizing because they have a lack of access to sanitation and running water, those groups of people may be prioritized better, and they may actually, by vaccinating them, we may actually reduce the prevalence of infection hotspots. And so I think there's a role to be played in terms of looking at poverty and determining access on the basis of socioeconomic status.
Safura, let's talk a little bit, if we could, for the moment, about how this delay has come in. I'm not asking from a political perspective. Obviously, I'm not going to ask you to comment on that. But it's now being pushed out to the second quarter of next year. This, after being told, was the first quarter. In those months, those extra few months now, as we head quickly into winter of 2021, is going to make a massive difference. Just help the layman, help me understand, if the money has been paid for at least 10% of our population to get a vaccination, why can you understand why it's taking 6 months for it to land in South Africa?
So there's several parts to procuring a vaccine. And I think the fact that we're using a mechanism like COVAX, which is a consortium, a group of countries that have come together that are deciding to pool their resources to purchase a vaccine, makes things all the more complicated, because this is not the South African government going to a Pfizer or going to a Merck and saying, yes, we'd like to purchase X amount of vaccines from you, please deliver them. We are relying on the allocation in this group. So COVAX, as an advanced market commitment, has to decide what types of vaccines it's procuring, how it's going to deliver those things, and then it's actually got to get to the business of delivering the vaccines within each of the almost 175 countries that are members of COVAX. So that's the first component of it. And COVAX hasn't quite decided, to the best of my knowledge, which vaccine it's going to procure. The second issue is we need to decide which vaccines we are willing to take. So, for example, normally one would wait for a full approval of a vaccine before procuring it. However, we know that the Pfizer vaccine has received what's called an emergency use approval, which means that it's got sort of a lighter approval, not a full approval. Now, normally, COVAX would have wanted a full approval before distributing that vaccine, but it has allowed each country to choose whether or not it will take a vaccine that has received an emergency use approval. So that's an additional component, which is we need to make a decision about which vaccines we want to receive. And that question is not just about which one we like, it's about which one is feasible when rolled out in South Africa. And so that you can see it's quite complicated. It's not just a matter of saying, yes, I'd like a vaccine. There's a whole system that needs to happen that moves with it, and not all of it is within the South African government's control.
There's a lot of moving parts. Safura, I'm going to say thank you for that. I think it's one of, excuse me, one of the best explanations we've had from a non-political perspective as to just how this vaccine is actually going to land here. So I'm going to say thank you to you for your time this morning in explaining that to us. Safura Abdool Karim from the SA Medical Research Council, talking about the vaccine, when it gets here, who is going to get it, and who makes that decision.